Why do you have to study? Any answers?
Drug interactions are different for different individuals.
Mm. More than drug interactions, we call the rate at which the drug is metabolized, the effects of the drug. There are two things: how does the body react to the drug, and what the drug does to the body. Okay? So, how fast the body uses the drug, metabolizes the drug is one part, and how fast the body, how toxic the drug is to the body is the other part. Okay? So, in order to study those things, the metabolism, the toxicity, and all, we have pharmacogenomics. Every person has a different kind of response to the drug. For example, a simple case study I'll say: if I take paracetamol, some people recover fast in 30 minutes. Some people get relief only after 1 hour. Some people get relief only after 2 hours. That might be because of the genetics behind the person and the action of it on the drug. Okay? Now, how do they study? They have taken the drug, they have taken a set of people and they administer the drug, and they study how the people are responding to it. They take, they divide, for example, they have 100 people, they give a drug X, and they say how they are responding. In that 100 people, 10 people respond very nicely, 90 people didn't respond so well. And in these 10 people, in these total 100 people, this 10 and 90, they check the mutations which are present, and they say that because of the presence of this mutation in these people, the drug is behaving efficiently in them. Is this part clear?
Yes, ma'am.
Yeah. Now, where do we get this information? For example, previously this was called PharmGKB. Now it's renamed as ClinPGX. So how do we get, and what do we get from this? This can be searched with the gene name, RSID. RSID means the SNP or a drug name. Here we have currently searched with the drug warfarin. Okay, we get into the drug. And here when you see some
Ma'am,
drugs,
are you sharing?
oh sorry, I'll share it. Okay, so here we can query with the RSID, we can query with the gene name, and we can query with the drug name. Okay, and when I said here currently I have searched with warfarin. When I search with warfarin, here we have some information. And what are the drug label annotations? Means whether this drug has any genetic variants which are approved by FDA. HCSC is also a consortium like an FDA which approves the drug usage. Okay, what did they prescribe? Annotation of FDA label for warfarin, we have to use the mutations of these two genes when you are checking for the how the drug is acting in a person's body. Is this part clear? Now, how do we check? What do you check? There will be a complete article on it. For example, a person who carries these mutations may have a prolonged time to get an effect. So, what mutations and what we have to consider? There will be a complete table which I'll show you a little later. Okay, so here you'll get the information whether the FDA is approved, CPIC is approved. You have many others. I have HCSC is other one. So we have many other sources from which the drug is approved based upon the mutations. For example, there are many drugs which are FDA approved, but we do not have the genetic mutations and the study effect with the genes and the mutations and the drug. We do not have that relation. We have only a small subset of drugs and the mutations that affect the metabolism of the drug in a human body. Is this part clear? Now, we'll come to the variant annotations. If you see here, variant annotations, these are the number of references and all which we have. So this is the RSID, this is the PubMed ID in which it is studied, the gene in which this is present. And now if you see, the people with TT genotype, associated with decreased dose of warfarin with a heart valve replacement. You have to give a lesser dose if you are giving it to a person who has a heart valve replacement as compared to this, right? Now, whether it is significant or not, we are generally interested only whether it is yes. Non-significant means they have done a study but there is no significance. What is a p-value at which it is significant? How many cases? This study has been done in 231 cases. This study has been done in 4886 cases. Which population they have done? What kind of a study it is? Whether it's a dosage, toxicity or efficacy. Okay, that's the more information which we get. Now, so this are people who carry this RSID, whoever having a T allele should be administered a lesser dose. That's what is the conclusion of this study. For example, if you see this particular RSID, this RSID is present in CYP2C9 gene, and what is the effect of it? People who carry with C allele should be associated with a decreased dose when compared to A allele. Okay, so they have, when you give a more dose, might be it is toxic. That's the reason whoever carries a C allele, they should be given a decreased dose. How do we get more information about it? This is the article associated with it. Okay, if you go through this article, you'll get more information. Now, we have set of drugs called CYP2C9, CYP2D6, TPMT and all. These we have a star notation. Star notation means it's a combination of one or two mutations. So where a person carries a mutation at one position A and position B, that is represented as star 1. A person carrying a mutation in position A and position C, that is represented as star 3. So whenever you have a combination of mutations, n number of mutations which you have considered, then they give a star notation associated with it. Okay, so generally star notation means people who have a star 1 notation means there are no any mutations. They are normal metabolizers. They metabolize the drug normally. People who have star 2 notation, there are poor metabolizers, means if you give 50 milligrams of drug to a star 1 notation person and a star 3 notation person, the star 1 notation person metabolizes normally, he will not have any concerns. But the same 50 milligrams if you give to a star 3 notation person who carries a mutation, the 50 grams would be metabolized very slowly. When it is metabolized very slowly, large amount of drug would be present in the blood. When the large amount of drug is present in the blood, it would be toxic. Okay, so what should we do? When a person is a poor metabolizer, we have to reduce the dosage so that the amount of drug which is present in the body reduces. Is this part clear?
Ma'am, then star 2 and star 3, both of them are core metabolizers.
We have different ones. For example, how do you know which one is it? For example, there is an resource called CPIC. Okay, CPIC guidelines. If you go here CPIC and if you give CIP, okay, you have to give here genes or drugs, CYP2C90, CYP2C9. So which people are I mean, it's a big article. We have been reading it left and right, so I know where is it located. So I'm just directly going there. See, people who carry a star 1 notation are normal metabolizers. Okay, people who carry star 1 star 2 star 1 star 3 or star 2 star 2, they are intermediate metabolizers. These are poor metabolizers. Now, how do we give the drugs for them? There will be a complete guideline here. See, for a normal metabolizer, you have to give a normal drug dosage. For an intermediate metabolizer, initiate, if it is effective or non-effective, reduce the effect, reduce the drug. If it is a poor metabolizer, just give only 20 to 25% of the dose. If it doesn't affect If you don't find the effect of the drug, change an alternative therapy. Okay. So CPIC, PharmGKB, we consider both into considerations in order to prescribe a drug. Is this part clear? I know it's little fast, but I'll be giving you a task so that you can get more information about it. So CPIC is one place where you get the information and PharmGKB is another place. Here the information would be documented, but it will not be so clear. So when we know that we have to use CYP2C9 and VCOR1, whatever it is, we directly go to CPIC and here we'll check. For example, in CPIC we can check what is the dosage associated with warfarin. Warfarin. So warfarin, CYP2C9, CYP24FA, VCORC1. So all three, here it is actionable. So here CPIC has been given level A and FDA has given actionable. So they generally consider mutations of these two in order to study how warfarin is metabolized in a person's body. And these are the references for it. Okay? Understood this part?
Yes, ma'am.
Now, how do you get which star and which RSIDs we have to consider? CYP2C9. If you just query here, go to that particular resource, you have something called a named alleles. Wherever there is a star notation, see, star 2 decreased function. When do you call a person a star 2? If you click here, they give a person who carries a mutation at this particular position, okay, is called a star 2. Okay. Now go back. When you call it as a star 3, a person who carries a mutation at this particular position, okay, when a person carries a mutation at this particular position is called a star 3 notation. Star 5. When do you call a person a star 5? A person who carries a mutation at this particular position, this is GHRC38, you call it as a star 5 mutation. This gets difficult in order to check each one, so they would have given a survey submitted. Okay, you can download all these star notations in form of a file. Hello Andy Arvind garu. Okay, we can download these star notations in form of a file. Okay, these are all the possible mutations which can happen. Based upon that, it gives whether it's a star 1, star 2 or star 3. Let me just bring this to a smaller level first. See, a person who carries a mutation in this particular RSID, then it's called a star 2. If you see here, star 7 is also 1. For example, in some places you will have 2 mutations. I'm just trying to find which one is it. Star 18 means a person who is carrying both the mutations at both the places. That's called a star 18. So which RSID, which mutation you will get directly from this particular file. Okay. So CYP2C19 allele definition, you get this file. Is this part clear?
Yes, ma'am.
So when you want to check if the drug acts on a person's body or not, whether there is any genetic information associated with it, there are two resources to go: CPIC, PharmGKB. Okay, now it's called Clean PGX or something. You go there, you search. If you find any variants, any other drug. One second. Let me find something. Hello, Andy Ramesh Garu. Hello, Varsha. Just a second. We are just in a part. We'll just finish this part and we'll start off. For example, let's check some metformin. Are there any guidelines approved for metformin? Okay, CPIC. As per CPIC, we do not have anything. Okay, let's go to PharmGKB. Let's check metformin. Metformin. Okay. If you see here, there is no prescribing info. There are no drug label annotations. As such, has not approved anything. Okay. But still you have some summary annotations and variant annotations which are of level 3. Generally, you should have a level 1A annotation for an FDA to get it approved. All these are level 3. Means you need some more evidence to actually use it and report it. Okay. Now, if you see here, according to metformin, we'll just check what are all are significant. So there are so many studies which are significant. Metformin, we know it's used for diabetes. So these are all the genes. These are all the mutations which are associated. Increased response to metformin. People who have this mutation have an increased response. These people who have these mutations are associated with gastrointestinal side effects. So, out of this, which one to give? Now, it depends upon the population size in which it is studied and the number of people in which it is studied. We generally go for a larger population in which it is studied, or we identify the studies where we have the number of cases and number of controls, and then we try to pick one and give. Picking one and giving, here it's a random choice, but still companies do just pick one and give. Okay, there's no hard and fast rule why only that has to be picked in these cases. But if there is something FDA approved, we should give only that. If it is not FDA approved, we try to give something which have a higher level annotations. Okay, level 2A, level 1, level 3 comes next, and the last one is level 4, I think so. I don't think if level 5 exists. And if everything is level 3, then we'll check the population size and we'll try to identify. Okay, so because we have attended this, I will give you a set of drugs. So please try to identify the variants for these three. Which one you would give and why? Okay, please copy it in the chat. I am pasting it in the chat. And send me it in a notepad. On these three drugs, which are the mutations? Why did you select? Okay, why is the most important part? You'll have a lot of information. There should be a reasoning why you have selected a mutation for that. Okay, just select one or two genetic mutations for these three drugs which you feel the most appropriate with your reasoning, and send me in a form of a text pad. Right?
Yes, ma'am.
Yes. Okay, then that's about today's session. We'll meet up tomorrow with this. Right?
Yes,
Okay,
ma'am.
then
Okay,
we'll proceed
ma'am.
with our next class then.
Okay, ma'am.
Yes.